Biphasic mesothelioma is an aggressive form of cancer associated with exposure to asbestos. While surgery, chemotherapy, and radiation therapy remain the primary treatments recommended by doctors, some people living with biphasic mesothelioma have found relief through complementary and alternative approaches. It's important to note that no alternative therapies are proven cures and should be discussed with your oncologist when used alongside standard treatments. Some options worth considering include nutrition and lifestyle changes. Adopting an anti-inflammatory, whole foods diet rich in fruits and vegetables may help support the immune system's response to the cancer and treatment side effects. Staying well hydrated, limiting alcohol consumption, quitting smoking if applicable, and managing stress through yoga or meditation can also aid the healing process. Certain supplements like turmeric, ginger, and green tea extract contain powerful antioxidants and compounds that may help slow tumor growth. Monitoring vitamin D and omega-3 fatty acid levels through blood work can ensure deficiencies don't hinder recovery. Acupuncture. This ancient Chinese practice uses thin needles inserted into specific points on the body to relieve pain and stimulate the nervous system. Studies show acupuncture may ease side effects of chemotherapy and radiation like nausea, fatigue, neuropathy, and mouth sores while improving quality of life. It has also displayed antitumor and immunologic effects in some cancer research. Acupuncture should be performed by a licensed acupuncturist with experience treating cancer patients. Herbal medicines. Several herbal remedies have a long history of use in traditional medical systems and current research exploring their application in cancer care. Some options studied for mesothelioma include ginseng, which may enhance the immune response, curcumin from turmeric with anti-inflammatory and antioxidant properties, polysaccharide K from mushrooms like Coriolus versicolor that activates immune cells, and resveratrol from grape skins with chemopreventive abilities. However, herbal products can interact with prescription drugs, so always consult an herbalist or pharmacist knowledgeable about oncology herb-drug interactions. Hyperthermic intraperitoneal chemotherapy, HIPEC. This procedure involves surgically removing visible tumors, then administering ultra-hot chemotherapy directly into the abdominal cavity using a special device. The heat helps the drugs penetrate deeper into tiny tumors and tissue spaces not reached by conventional treatment. Some studies suggest HIPEC combined with cytoreductive surgery may extend survival time for select patients with peritoneal-based mesothelioma, but larger trials are still underway. Risks include infections and complications from the invasive nature of the surgery. High-dose antioxidant therapy. Rather than focusing on any one antioxidant supplement, this approach utilizes intravenous injections of high-dose, mixed formulations containing intravenous vitamin C, K, B3, B12, and plant extracts like Protacidic. The goal is to achieve blood concentrations many times higher than oral doses to deliver a maximum detox and antioxidant effect within tumors and tissues. Proponents claim it reduces side effects and enhances standard cancer care, though significant research is still needed to evaluate benefits and safety for mesothelioma patients. Targeted therapies. As researchers learn more about the molecular changes that drive mesothelioma growth, new drug treatments targeting specific genetic mutations and pathways are being tested. Immunotherapies aimed at harnessing the immune system against cancer cells also show promise. Phase 1 and 2 clinical trials continuously explore targeted agents like bevacizumab, cetuximab, ruxolitinib, and nivolumab alone or in combinations with chemotherapy for refractory or relapsed disease. While none are approved yet, some provide prolonged stabilization of the cancer and improved survival times worth discussing with an oncologist. Ozone therapy. This complementary approach uses medical-grade ozone gas administered through various techniques. Proposed benefits for cancer patients receiving ozone include improved oxygen delivery to hypoxic tumors, immune cell activation, changing cellular pH levels, and oxidation of excess lactate. While ozone therapy has shown anti-cancer effects in preclinical research, quality clinical evidence for its application in mesothelioma treatment is still limited. it should only be considered as an adjunct to standard treatment under a doctor's guidance, since risks like oxidation stress and lung damage exist if not delivered properly. Faith, hope, and peace of mind. Maintaining a positive spiritual and mental outlook through challenging health issues has real importance. Spending time with loved ones, reflecting on life's beauty, engaging in acts of optimism, practicing gratitude, participating in faith-based or secular support groups, utilizing counseling, and embarking on end-of-life planning with palliative care specialists can all potentially lift overall well-being and quality of remaining time. For some, alternative therapies merely allow exploring all available avenues toward healing body, mind, and soul during an already difficult journey. Biphasic mesothelioma patients and their families should feel empowered discussing both conventional care and the above complementary options with skilled oncology teams. An integrated care model combining therapies wisely can optimize prognosis while also supporting peace of mind on the treatment path ahead. No single approach holds supremacy. Rather, focusing on nourishment, movement, emotional support networks, and care of the whole being complements the science of the disease itself. With compassionate care and open-minded self-care, patients find strength along whatever journey arises.